Welcome back. It's now 29 minutes after 8. We are on what we'd call the final lap of the show this morning. And on Wednesdays, we have the segment called Your Health. And today, I am joined by Dr. Samrat Shah. Thank you for joining us this morning. We're also expecting Dr. Gidanga, who should be joining us not too long from now. But as we continue, today we'd like to talk about emergencies. But before that, we're just having a conversation before we went on air. And it's to do with the weather that we're having. It's currently raining. That, of course, leaves us exposed, and you're talking about somewhat a myth regarding pneumonia. There are many of us who believe that possibly pneumonia would be caught if you're, rained on. Is that a fact or a myth?
No, it's a myth. Pneumonia never occurs like this. Pneumonia is a very difficult disease to come through, because it's not very easy for you to get pneumonia, because we have a lot of protective sections in the body which help you to prevent from getting pneumonias, like the upper respiratory tract, the lower respiratory tract. They help you to prevent yourself from getting pneumonia. So we should never consider it as pneumonia if you get common cold, flu, joint pains, body ache. These symptoms are not symptoms of pneumonia.
How does one get pneumonia? Because I know I've also grown up being told that if you are exposed to cold or if you're rained on, then you're likely to get pneumonia.
Yeah, see, this is actually not a fact at all. You cannot get pneumonia just because of exposing yourself to the rain. Pneumonia is commonly seen in old age people, those people who have chronic illness in the form of diabetes, hypertension, tuberculosis, HIV. These patients are more prone to get pneumonias. And when you have pneumonia, the symptoms are not that simple. You'll have breathing difficulty, you'll have cough, you'll have sputum production, you'll have high grade fever, you'll have starting to lose weight. These are the main symptoms wherein you can start thinking about pneumonia. Sometimes even when these symptoms are there, based on our clinical examination, we decide whether it is pneumonia or not pneumonia, because these symptoms can also be seen in other diseases.
Okay, so what you're saying is that I cannot get pneumonia by virtue of the fact that I'm exposed to the rain. How does pneumonia occur?
Pneumonia is usually seen in immunocompromised patients. So in the sense, if you are a chronic illness patient, like diabetic patients, they are prone to have infections. Any patient who has undergone a spleen surgery, they are prone to get infections. Or old age. So it's not very common that at a younger age group you'll get pneumonia and you may have complications. You may get pneumonia also. Nowadays viral pneumonias are coming up in the form of influenza pneumonias are known. But provided there is an epidemic of influenza, only then we can consider about it. Otherwise, we cannot normally think about pneumonia at all.
Okay. Another challenge that comes with the current weather that we have is many people imagining or thinking, or maybe through the symptoms, assuming that they have malaria.
Yeah.
And this is, presented through joint aches, maybe a little bit of a headache.
Yes.
Is that necessarily an indication that one has malaria?
No. You see, what is happening in today's world is we are in a dangerous state right now, because people have habit of taking the medicines over the counter for malaria.
Right.
Thinking that I have joint pains, I have malaria. Just one day symptoms of joint pains and some weakness, they feel that they have malaria, they go to counter, they take the malaria medicines. Self-medicating. What is happening? The malaria medicines which have been developed, there is just one medicine which has been developed few years back, around 20 years back, and till date there has been no research still in malaria. Just imagine, if you start using those medicines again and again, you develop resistance. The day is not far when we'll go back to 18th century where there is no medicine for malaria and people are dying of malaria because of drug resistance.
Right.
You take the over-the-counter pills, you develop resistance to those medicines. Next time when you actually have malaria, it does not help.
It doesn't help.
Yeah.
And what are some of the key symptoms that you would indicate that show somebody that they have malaria?
See, for malaria, one is there should be history of exposure to that area of endemic area of malaria. Otherwise, apart from that, just that does not decide, because even some people say that I went to up country and I think I have malaria. So that should not be the case. Once you travel there, then there are other things which you need to see, like fever, chills, rigors, headache. Along with that, we see something called as splenomegaly, and then peripheral blood smear examination. All these together decide whether you have malaria or not. Just traveling to up country does not prove that you have malaria. One more important thing which I want to highlight is, if you're traveling to up country, if you're going to endemic areas, please make sure that you visit your doctor and ask him if he can take any prophylaxis for prevention of malaria. That is much better than taking unnecessarily medicines for prevention treatment.
Absolutely.
Yeah.
And would you then say it is not safe for somebody to conclude they have malaria just based on symptoms? Must you go for a test?
Yes, exactly. Just based on the symptoms, you cannot decide that it is malaria. You should go for blood test. On day 1, the blood test may also come negative. We still wait for another 2 days. After 48 hours, we repeat the blood test. In case if that comes positive, only then we start malaria medicines. Otherwise, we don't start malaria medicines.
Any other maybe illnesses or ailments or challenges that we should be wary of, particularly weather related, given the kind of rains that we have and the cold?
So present situation, the most common thing what we see in OPD today is the viral infections. Most of the people, they come with flu, they come with joint pains, they come with weakness, myalgia, fatigue, which is there for 2 to 3 days. I just want to highlight these things. Please do not take antibiotics. Please don't take antibiotics because they are not necessary in viral infections. It's a viral infection and antibiotics acts against the bacteria. So there is no point in giving a antibiotic which is going to act against bacteria for a viral infection. So you should wait for 10 days. Even the American guidelines clearly states for 10 days you should wait for.
So for any viral infection, what you're saying is before I take anything, I wait for 10 days.
Yes, exactly.
Okay. How do I know that it's a viral infection?
Commonly, we wait for 5 days. After 5 days, if the fever is increasing in trend, if the symptoms are increasing in trend, that is the point when you reach hospital and ask the doctor whether anything to be done for this. Yeah, and even after that we do some blood test which will confirm it is a bacterial infection. Otherwise, till 5 days you can just take paracetamol tablet and nothing else.
All right, let's now look at emergencies because that's what we wanted to discuss, and this is in regards to the festive season that is coming up. We do have people who have what we'd call lifestyle diseases, hypertension, diabetes, that require constant medication and possibly a kind of a diet. But as we get into the holiday season, sometimes people travel and they forget their medicines. What are some of the like a checklist one should have, should they have one of these diseases, that they need to ensure that they have on their checklist?
Yeah. So first thing what I want is, because it's 1 month long holiday coming up, so I want people to understand that they should go check their sugars if they are diabetic, check your pressure if you are having blood pressure. If you are having heart diseases, make sure that you do an ECG and do some routine blood tests which are required. If you are having cholesterol, just check all the basic diseases what you have at least once before you start
So even
traveling.
for those who may not be aware whether they have these diseases, it's necessary to do those tests, particularly if you're traveling.
Ideally, after age of 30, it is recommended that at least once in a year, you should do all the blood tests which are necessary to see if you have lifestyle disorders. Because today's lifestyle is so bad that we have come to the age of 30 and we start checking at the age of 30 if you have
Before
lifestyle
it used
disorders.
to be 50.
Exactly. Now we check it at 30 because our lifestyles are so bad. We don't do exercises, we don't go for running, jogging, any of these exercises. So it's recommended that after the age of 30, now at least make sure that once at least you check all these things before you travel and make sure that you carry all your medicines. If you're diabetic, hypertensive, cholesterol, if you're having heart diseases, make sure that you take all the medicines with you for a month. You know what commonly we see? People carry medicines for 10 days, then they don't have medicines, they don't find medicines in local areas, they just stop medicines, which is a deadly thing, which can kill you. So better take all the medicines, make sure that you have checked everything, take all your medicines and start getting a diet advice from your doctor before you travel. Because it's a festival season, we are prone to eat so many stuff. So make sure that you have your diet plan before you start.
Okay, let's talk about maybe diabetes and break it down a little bit in terms of even the diet, because the other thing that happens as we get into the festivities, we get carried away with, the kind of food that we eat. Maybe when you're on, say you're diabetic, you're supposed to eat a certain quantity of sugar and all that. Maybe just some precautionary measures that we should take so that when we get into the festivities, we don't feel like we're not enjoying ourselves, but at the same time, we are cautious of our health.
Exactly. So what you need to do for a diabetic patient is, I know people like fruits a lot, but fruits are not good for patients who are diabetic. So if you want to have fruits, you can have it in between the meals. Like 10 o'clock in the morning, you can have fruits, and night before going to bed, you can have fruits. But it should not be with the meals. When you take fruits with the meals, the sugar levels increases. So make sure that you avoid taking sugars with your heavy meals. Like breakfast, lunch and supper, don't take sugars or sweets or fruits with these meals. You can take them in between. You can take fruits at 10 o'clock in the morning and 10 o'clock in the night. The same way, if you want to take some sweets, you can take it in between your meals rather than taking at breakfast or lunch or dinner. Make sure that you avoid carbohydrates as much as possible, because we know we eat a lot of porridge, a lot of carbohydrate diets we eat.
Chapatis,
Yeah,
ugali.
exactly. Ugali, then potatoes, chips. We are fond of all these things, but make sure that you avoid these things as much as possible, because in the festival season you are prone to eat a lot of fruits, you are prone to eat a lot of sweets. So at least avoid some carbohydrate diets so that you can balance yourself with the sugars. And sugar, as much as possible, you should avoid.
Should avoid it.
Yes.
All right. In a case where, for instance, if one is diabetic and they have not carried their insulin, what are some of the precautions or measures that one should take?
Yeah, about insulin, I want to clear one thing. People have a myth that insulin should be kept only in the fridge. That's why people, they don't carry the insulin. That is very common thing what we normally see in the OPDs. But it's not the true. For 20 days, insulin can be kept in a normal temperature of 18 to 20 degrees.
Room temperature.
Room temperature. Because our country is very cold. It's not like India wherein it is very hot, where the insulin can get spoiled. Our temperatures normally do not vary more than 18 to 20. So we can keep insulin even at a room temperature. Don't keep it exposed to the sunlight. You can keep it somewhere below the table. Insulin is safe to keep it for 18 to 20 days.
So for anybody who was thinking they should not carry their insulin because there's no fridge up country, they can carry it.
They can,
but keep it in a cool place.
Cool place, that's
okay. And what about if you forget that insulin? What happens?
If you forget your insulin, especially, we start insulin only when your sugars are not getting controlled with your tablets. So in that case, if you're on insulin, you should not forget you're taking insulin, because if you forget taking your insulin, one, your sugars are going to shoot up. Two, because it is festival, you are tired, you are lazy, you don't want to do exercises. Three, we eat a lot of food habits which are going to increase your sugars. So all these three things together will add on to your sugars. So better avoid missing your insulin. So it's good if you can take your insulin and go.
Okay. Carbonated drinks, sodas and all that?
Sodas are not good for health at all. One of the common thing what I have seen here, people think that when you have ulcers or gastritis, you take sodas, it will be better. But I want to tell people, sodas are the one which increase the gastritis, which increase the acidity problems, which increase your sugar levels. They have so many bad effects on body. So soda should always be avoided.
Should avoid them at all costs. So what about cakes and that? Because with the festivities comes in a lot of merrymaking, cakes and sweets, just desserts.
Yeah. So desserts you can take provided your sugars are controlled. If you are on insulin levels, I would suggest you can increase the dose of insulin to 5 or 6 units. And then if you want to still enjoy your festival, increase the limit of 5 to 6 units of insulin and then take your sweets or desserts. But try to take it in between your meals, not with the meals, because our breakfast, lunch, dinner, they already have a lot of carbohydrates. So avoid it taking with the meals. You can take it in between the meals. If you're on insulin, just increase the dose of insulin by 3 to 4 units when you're taking those sweets.
Okay. For somebody diabetic, how important is it to share, particularly with those you're traveling with? Sometimes you'll find people who travel with friends and they may not be aware that you have this kind of disease. How important is that? Should there be an emergency, maybe they'll know what to do.
Diabetes is actually called as a silent disease. It's a silent killer. It's good if you can discuss with everyone. Diabetes should be discussed among your friends and family, because diabetic emergencies, diabetes related heart attacks, they are silent. You don't even get chest pain.
You don't even know.
No, you don't even know. You come to hospital when you have chest pain. You will never come to hospital if you don't have a chest pain. Are you understanding? So my point is, you should discuss about diabetes and their complications, because they are silent disorders. They don't come with any symptoms. Like diabetes related eye blindness. I have seen a patient who came to me, got up in the morning, he was blind, completely blind. Then retrospectively we got to know
the night
that
before he was okay.
He was okay, and then he was having some blurring of vision, but he ignored that part because that is not a major symptom. And then next day morning when he reached the hospital, we found out retrospectively he was diabetic, his sugars was very high, and because of diabetes his kidneys have shut down and his eyes are gone. So that's why it is important that once in a year you check, discuss about the complications of diabetes within your family and friends, so that everyone is aware about it.
Now, in a case where somebody is diabetic, what are some of the symptoms should somebody get into an emergency? And I ask this because I've had relatives who went to bed and everybody thought they were okay, but the next morning they were gone.
Yeah.
Are there things or indications of somebody diabetic and maybe at a point where they're not able to communicate that we're able to tell this is an emergency?
You see, diabetic patients, they don't come with symptoms of emergency. That's why it is called as the most deadliest disease today. Because it's a silent disorder, it can kill person without having any symptoms. So most of the times diabetic patients, they don't have any symptoms. But some symptoms which may have been come, like you may feel a lot of thirst, you may feel you're passing a lot of urine, you may feel you're feeling hungry a lot. These are some common symptoms of diabetes. Apart from that, if you are feeling that your urine output has come down, you are having some blurring of vision, even a minute blurring of vision, or you can see that there is some flutters coming or some cloudiness coming in front of eyes, please don't ignore these things. Rush to the hospital and find out if you're diabetic and having these complications. Apart from that, any person who is diabetic or hypertensive, having even a small breathing difficulty while walking or climbing stairs, be aware that it can be a heart problem. Reach the hospital immediately.
All right. Another lethal disease, and you'll correct me if I'm wrong, they say is a silent killer, is hypertension.
Yeah.
And maybe some of the symptoms that one can check if they're hypertensive.
Yeah. Even hypertensive patients, the most of the times they don't have symptoms unless you reach the hospital and check yourself. That's why these are called as preventable diseases, wherein you can go to the hospital, check yourself once in a year if you have pressure. But some symptoms which are seen in hypertensives are, like you may have headache, which is more in the occipital region. So occipital headache is the very common symptoms with patients with blood pressure. But don't be in the fact that any occipital headache is blood pressure. It's not the fact.
Right.
But some patients can have occipital headache. Apart from that, the complications of hypertension are the same. We have seen kidney failure patients coming directly to us and then retrospectively getting know that they are hypertensive and then they got kidney failures. So any signs of decreased urine output, any sign of breathing difficulties, any sign of blurring of vision, having occipital headache, please reach the hospital, check your blood pressure.
Okay. And any causes of hypertension?
Hypertension, 99% of the times is genetic, wherein the genetic and the environmental factors together make you having hypertension, and in that we are staying at a higher altitude, so we are prone to get high blood pressures. Apart from that, only 1% of the patients, they have other causes for hypertension, which are very rare. We try to find out those causes only when the blood pressure is seen in a patient who is less than 25 years of age. If you are young and having blood pressure, please don't ignore this. Reach the hospital, try to find out if there is any reason which is treatable.
There's also a myth that, hypertension is mainly for the old people. Is that necessarily true?
No, I have seen a hypertensive patient in 12-year-old kid.
12 years.
12-year-old kid.
Wow. And also there's another myth, you tell me if it's not a myth, that it's also a disease mainly for people who are obese.
Yeah, it's not a myth actually. It's not mainly seen in obese also, but obesity is one of the risk factor for hypertension as well as diabetes. But if you have family history of hypertension, if you have family history of heart diseases, diabetes, if you are diabetic, you are per se prone to get hypertension also.
But hypertension is not necessarily only genetic. You can also develop it over time.
Over time, yes.
Okay.
Yeah.
So I guess what you're saying is that also diet here is crucial.
Yes.
Are there any foods that possibly would spike the probability of either being hypertensive, or if you're hypertensive, to make your situation worse?
Yeah, the best thing for hypertension is reduce your salt intake. Ideally 2 to 3 gram of salt. It's very difficult to calculate 2 to 3 gram of salt eating in a day. But what we advise is make packets of small packets of 2 to 3 grams of salt and keep them. In an entire day, you should only use that much amount of salt. Don't add any salt while cooking food. If you are hypertensive, that's the best thing to do. Apart from that salt, the spicy food, the masalas what we use, these things are bad for hypertensive patients. And meat intake. Because of obesity, meat intake, they all add on to your hypertension.
And I've seen a lot of articles talking about the salt and sugar being white poison. Do you agree with this?
Yes, I totally agree with that. It is a white poison because you take salt, you take sugar, you're prone to get all the diseases in the world.
Okay, maybe as we conclude, as we summarize, maybe just a rule of thumb, some of the things that we ought to be careful with as we're going out on holiday, as we're going out, to different environments. There are some of us who go up country, others may go out of the country. Some of the things that we need to be wary about, particularly if you have these lifestyle diseases.
Yeah, for lifestyle disorders, one, make sure that before you travel, you check yourself completely. Make sure that you do all your blood tests and take your medicines and go. Second thing, Don't think that insulin should be kept only in the fridge. You can keep it anywhere. Please carry your insulin. Take all your fruits and sweets or pastries or desserts in between your meals. Don't take it with the meals. If you're taking pastries and if you're on insulin, make sure that you increase the dose of insulin to 4 units in the morning and 4 units in the evening. I think that should be enough to take care of.
That should be enough. In case of an emergency, what does one do if you're the one now, not the one who's in a position, but possibly you're with a friend who's either fainted or maybe has had a heart attack? How do you react to that?
Yeah, if you had a heart attack or you fainted, I think the first thing you should do is call for an emergency and reach the hospital as soon as possible. But I would like to tell one thing. If any patient who is diabetic or hypertensive gets a chest pain and he collapses, make sure that you at least put some tablets of aspirin, at least 3 tablets of aspirin you put and 1 nitroglycerin tablet you put in the mouth before you reach the hospital.
Okay.
That could save someone's life.
I think you also mentioned the importance of having, even if you don't have these lifestyle diseases, to be tested from the age of 30.
Yes.
Any estimates of maybe what a test would be? Because one of the things, the limiting factors might be cost.
Yeah, after the age of 30, you need not check everything. Some people come and they want to check everything in life. They don't have to. You can just decide based on the family history. If there is family history of diabetes, just check your sugar, and it's not very expensive. If your family history is having the hypertension, just check your blood pressure and sugar, nothing required else. If you are more than 30, just check your sugar and blood pressure and thyroid if required, if it is in family, otherwise nothing else to worry.
Importance of exercises, even as you're on holiday, sometimes we tend to put our exercises aside.
Yes.
Maybe just some, basic exercise that you can even do in your room or...
Yeah, exactly. So if at least not possible every day, at least 5 days in a week, for 20 minutes, you can just do skipping at home. Or you can do cycling if you have home cycle, or you can do running or jogging. These are the simple things which we can do at least 20 minutes for 5 days a week. You can enjoy your Saturday and Sunday, at least from Monday to Friday, give time to your health.
All right. Thank you very much, Dr. Samrat Shah, for joining us this morning on Your Health. And that's where we wind up the show. And at 9 minutes to 9 o'clock, we take this opportunity to thank you for watching Morning Express. And do stay with us as we continue to bring you more news and reviews. News Center is lined up for you. From me, I say have yourselves a wonderful day and do keep safe as we continue to have pounding rains. Take care. God bless.